video is part 2 of the Leveraging Performance Improvement in the COVID-19 Response ASTO Expert Series. In part 1, we heard from the South Carolina Department of Health, who leveraged their accreditation planning efforts and culture of quality improvement to evaluate and make improvements to their COVID-19 response strategy. In this video, we will now hear from the Florida Department of Health's Deputy Secretary for Health, Dr. Sharmarial Roberson. Dr. Roberson will discuss how Florida reached out to young Floridians by leveraging its community partnerships, communication strategies, and programmatic work with youth to develop an evolving communication campaign around COVID-19 risks.
We have a performance management council here at the Florida Department of Health. That performance management structure is headed by our Division of Public Health Statistics and Performance Management. We have a system where we have a council and we review performance measures. So we have an agency strategic plan in which we have goals, strategies, and objectives. So in any of the goals that we're working towards in the department, we already have a system in place to measure performance. So in terms of COVID, our system was in place and we've just worked to implement strategies around COVID-19 to work into our agency strategic plan using this performance management model. In terms of partnerships, we use the relationships that we have, in this case, youth partnerships. So in our Tobacco Free Florida program, which is our program to combat vaping in youth and tobacco products, we already had a youth advisory board as well as youth media assets. So what we did using that program coupled with our adolescent health program, we use our existing partnerships around youth in the state of Florida. We quickly use our vendor to get together a strategy to identify formative research so that we could identify the messages that would resonate with kids. So they came up with a survey and then they surveyed these group of target individuals, and in this case, youth, to see what would resonate with them. And this was a tried and true model in Florida. It was evidence-based. We've used these type of focus groups and survey methodologies in the past to figure out what would be effective. So in terms of planning, we quickly deployed the strategy that we use in youth tobacco interventions for COVID-19. So in any situation, when you're going in, you look at lessons learned from evaluation. So we're heavily rooted in evaluation. We use logic models. We look at the goals we want to obtain. Then we look at the inputs that we need to obtain them, whether it's money, partnerships, resources. And then we work together to quickly identify what could be potential roadblocks. In this situation, what we've noticed in Florida is that we have a very diverse population. And what I mean by that is we have a very large Haitian Creole population as well as the Hispanic populations. Our communications department early on worked with the programs to quickly deploy media assets that were translated in Spanish as well as Haitian Creole, as well as our entire website. So going into this youth campaign, we realized that in some of our larger counties that we would have a large proportion of that population that would speak Spanish as well as Haitian Creole. So identifying that challenge early on and lessons learned from our other media campaigns, we ensured that our survey population and focus groups of children included a diverse group of students, including students with disabilities as well, so that we could make these assets available in multiple languages so that the message would really resonate throughout the state. First, you need to understand that you must be nimble, able to change. So the only thing that has been consistent about this pandemic is that it is ever changing. With COVID-19 being a novel coronavirus, we've learned a lot of lessons along the way. So there was no existing literature for you to look at and review related to COVID-19 media assets and different things. So what you count on is a performance metric system that's tried and true. So that's looking at the things that you're doing, implementing those things, using evaluation, looking at the videos, the different things that are working, looking at and taking feedback from our youth to say what's not working and quickly applying new strategies. So with our marketing vendor, when different types of videos or graphics show up, our marketing vendor is looking at those videos. And if some videos are not getting as many hits, they show those videos and graphics less. And the videos and graphics, for example, that are doing well, then they show those a little bit more. So we let the metrics from the social media campaigns drive what we're putting forth to the public. Performance improvement is the core of public health. It is very, very important that when you go into anything, at first you identify a goal. You identify the goal that you want to reach, and then you work with individuals internal to your agency and external to the agency to make sure you have the partners in place. Next, you identify, whatever funding it is that you need or partnerships that you need to be successful. And most importantly, you have to identify your target population early on. Once you identify your target population, you look at lessons learned from other areas where you work to reach that target population. After you have that and you start to identify those strategies that you need to reach your goal early on in the process, not at the end, you have to realize your objectives and have a baseline and have what target you want to reach. And if you have that baseline, you have that target, then you work to reach that. And in many cases in public health, a lot of times you can't look at health outcomes. You have to measure the process because it takes a longer time to look at that health outcome. And in this case, this is a virus where we're learning as we go. So in this situation, it is very important that you're watching your metrics and your measures to be able to do this. And in this case with youth, being at the focus of this, it was important to understand what they needed to know, what would resonate with them with mitigation strategies, and be nimble on this response. And then as we've moved into the next phase of this pandemic with youth going back to school, we've launched an additional campaign. So what we're doing with the additional campaign is keeping with the mitigation strategies that we had before, but really focus on active living and healthy eating, focusing on making sure that mental health is very important, making sure that, tobacco cessation and other resources as it relates to vaping are available to youth. So we're really working towards making sure that those resources that a youth will need to be successful physically, mentally, and emotionally, that we have those resources available. And we're making sure that youth understand that in this response, as well as being physically healthy, it is important to be mentally healthy. And we're working with our current partnerships to make that happen.
Florida's story is just one example of how health departments are leveraging the foundations from their accreditation and re-accreditation planning efforts and PMQI expertise into the COVID-19 response. Like South Carolina's strategy shared in part 1 of this video series, Florida highlights the importance of leveraging existing partnerships and utilizing data to drive decisions for internal and external quality improvement. During the COVID-19 response, your health agency might be collecting data on several internal and external processes and outcomes. We encourage you to use this data to identify informal and formal QI initiatives your agency can simultaneously conduct to improve its pandemic response. You might have also noticed that Florida's communication campaign for youth utilized a format similar to the Plan, Do, Study, Act quality improvement model. There are many other QI tools and techniques your health agency might consider utilizing during the response in addition to the PDSA model. Some common tools that can be quickly adapted include prioritization matrices, process mapping to lay out specific processes required in the response, force field analyses to weigh the pros and cons of the situation, affinity or fishbone diagrams for brainstorming, and the 5 whys to do root cause analyses. Both South Carolina and Florida's stories show us how performance improvement can play a role in not just health departments' day-to-day operations, but also emergency response, especially when time and efficiency are key to garnering the public's trust and executing successful interventions for the community. We would love to hear other examples of how your health agency has incorporated QI into its response efforts at performanceimprovement@asto.org.